From News 8, this is Live Desk Conversations with digital anchor Luke Laster.
All right, ladies and gentlemen, if you are joining us now, good morning. My name is Luke Laster here from the Wood TV Live Desk. This is another Live Desk Conversations. This morning joining us, Dr. Richard Van Enck of Bronson Healthcare. He's the Director of Infection Prevention and Epidemiology. Dr. Van Enck, how are you this morning?
I'm great, thank you.
Good. So a large topic of discussion today will be about vaccines, the vaccine rollout, things along that lines. Let's start with the rollout at Bronson. How is that going?
Yeah, it's going great. This is the best thing that's happened to us in the area of COVID since the beginning. So before, we didn't have a lot of tools to address COVID, and now we have something that's extremely effective. And so we're just trying to implement that as soon as we can.
So let's talk about, I guess, the specifics of it. When did you receive the first dose? Have you received it?
We've gotten COVID vaccine. The first vaccine that we got was from the Pfizer product, and we got that about 3 weeks ago. And so we get weekly shipments. We don't know ahead of time how many doses we're going to get, but as soon as we find out how many doses we're going to get, we create a schedule, and then people sign up and they come and get their vaccine. And our goal is to give every single dose that we get as fast as we can.
How's the reception of fellow healthcare workers been receiving it?
Good. It's been very good. Our healthcare workers are very aware of what COVID does to you, and the how the pandemic is going and how it's affected our lives and our families and so on. And so our staff are very eager to get the COVID vaccine.
How has the percentage weighed out of people who have received it versus people who haven't? Are there individuals who just aren't interested in it? Is it being enforced? How's that working?
We don't have a mandate for the COVID vaccine yet. As far as we know, no hospital has done that. But at this point, we're offering it to people. We're encouraging them to take it. We're saying that it really is an expectation for a professional healthcare worker to get it, to protect yourself and your patients and your family. And they're accepting that. So well over half of our employees have been immunized. It was a little bit difficult at first because the vaccine arrived right during holiday time. And a lot of people take time off during holiday periods. And so then it's a little difficult to schedule people around their vacations. And then, we're a little short staffed and so on. So there's some practical logistical challenges of trying to roll out a big complicated project, right around important holidays. But we got through that, and things are going well.
We do have one question in. Again, this came in ahead of time. We put this out about 24 hours ahead of time so we could get some questions from viewers in. This one comes from viewer Mary. She asks, hi, Luke. I would like to know how Bronson distributed the vaccine so quickly. I'm wondering Dr. Van Enck's opinion on other healthcare facilities giving the vaccine to priority health workers that are working from home. Are those people really in phase one?
Yeah, there's a couple of questions inside there. We don't control when we get the vaccine. The vaccine, remember, has all been purchased by the United States government, the federal government, and they distribute it to the states. And so each of the 50 states sends the county health departments and hospitals their allotted amount of vaccine. So in terms of when we started, that was not under our control. That decision was made somewhere at the state level to send Bronson so many doses. As soon as we got our doses, we were ready to go, and we started immunizing. I believe the day we got our first package, we literally opened the shipping container and gave that vaccine to people. So there was no delay in that. And so we wanted to get this done as soon as possible. How other hospital systems did that, I can't comment on that. All I can tell you is the way we structured our plan and the way we administered it.
So in terms of, we are entering on Monday the next phase with this phased rollout that MDHHS has, where teachers, other first responders, police officers can get it. Taking a step back from that, has everyone at Bronson been offered the vaccine, at least if they want to take it, all the frontline workers there?
Yes, we've gone beyond that. You're probably aware that there are healthcare workers working in that sector that are not affiliated with a hospital system. They're independent. And so not only have we offered it to all Bronson employees, but we've reached out to all those other healthcare workers in that sector in our 3 county areas to see if they need us to provide a vaccine to them. The county health department does that too. So this is in collaboration with the county health department. The county health departments are really responsible for those people, because if they're not part of a hospital, they're not our primary responsibility, but we're offering our services to those people as well.
And before we keep going here with what else we have, I do want to take a quick moment to point out there, if you see below my name in our boxes here, ladies and gentlemen, there's a small hashtag there that says #HeyLuke. If you have any questions for Dr. Van Enck in our live stream, I'm able to see your questions as you do have. You use that hashtag, I'll be able to pull it up again if it is relevant and legitimate and pertains to the conversation at hand. So, Doctor, let's go on to the next topic of discussion here. We see these mass vaccination clinics almost in other states. One that immediately pops into my head is Florida. We see lines that are very similar to what we've seen with actually getting tested for COVID. Do you see Michigan heading in a direction like that?
We have to give a lot of vaccine to a lot of people fairly quickly. At this point, the rate limiting step of population vaccination is how much vaccine we have. So at this point, no one is getting enough vaccine to set up those mass vaccination clinics like you talked about that we're seeing pictures on the news, or no one in Michigan is. And so we plan, and I think most other hospital systems plan to adjust the size, to scale the size of the program to the amount of doses that we're getting. And then if we get more doses, we'll scale up. And if we don't get very many doses, then that will determine the scale of the process. We'd like it to be organized so we don't have people lining up a lot of times. So our preference is to use some sort of a scheduling or reservation system so that you know you have a spot at this particular place at this particular time when you sign up, and then it's not just a kind of a chaotic first come first served situation.
And actually, that's a good segue into this question here. We do have one question I'm going to publish there for the viewers to see. This one's from Peggy. She asks a question basically about scheduling. When will the schedule and locations be posted? I think that's a good question about how will those be conducted? How will the schedules be conducted?
Yes, there's a group working on that particular issue, and that work group is led by each of the county health departments. And so our advice to folks is to consult the county health department website, and the latest information on those clinics and how to access, how to get into those clinics and when they're starting should be posted on that website. Each of the hospitals probably has a website, and Bronson has a website, and so we'll have some information on that. But the lead agency for community immunization is the county health department.
Gotcha. All right, Peggy, thank you for asking that question. Again, Doctor, thank you for answering that question. I'm going to unpublish that one now. Let's move into another point of discussion here is a new variant that we've been hearing about in the news and various places. First reported in the UK, I heard the state epidemiologist say the other day in their data update, say that she wouldn't be surprised if this was something that was already in Michigan. My question to you is this a point of concern?
Absolutely. What we've seen in Europe, particularly in the United Kingdom, is that when this new strain gets established in the community, it replaces the other strain because it's more contagious, it's more transmissible. And so it tends to spread faster. And what they've been seeing is another surge, where they had kind of a stable baseline level of infection. And then when this strain hits, the numbers go up again because it's more contagious and it spreads easier. So we're concerned about that. And, we plan for things like that, but it would not be unexpected for us to see a rise again in Michigan if this strain enters our state.
So I guess my next question would be, when testing for COVID, how are you able to specify if it would be that strain or COVID-19
Yes.
that we're used to?
Right. That kind of testing is really a very sophisticated molecular testing. It's really what they call genetic sequencing, and they try to look for that particular mutation in the virus. And so hospital laboratories don't have the capability of doing that kind of testing. It takes special expertise and equipment. But the state lab in Michigan does. We have a testing laboratory that does that kind of testing in Lansing. And so the Lansing laboratory is currently doing surveillance on specimens that come to them for COVID testing, and they can do that kind of test. So they're keeping track for the state. They're doing a certain number of these specimens every day. And so we should know when this new strain arrives because of our surveillance system based on the State Health Department laboratory in Lansing.
So in terms of the vaccination then itself, does it cover that?
The pharmaceutical companies that make the vaccines that we're giving say that their vaccines cover the new strains. You mentioned one in the United Kingdom. There's another one actually in South Africa now that's emerging as well. So the virus is always going to be a little bit ahead of us. There's always going to be some new strains. And so your question is very valid. We have to monitor the effectiveness of the vaccine against these different strains to make sure that the vaccine is still working. And so far it is.
So will we see, you mentioned another location there, will we see these different strains continue to pop up? And what would be, what's the concern with that?
Yes, there's two ways that could happen. One is that a very competitive strain will be transported through international travel around the world. And that's the most likely scenario that we have for the UK strain and what we've already seen in the United States, right? We've seen it in California, we've seen it in other places. And the other model that you described is the new emergence of a new vaccine, of a new strain of the virus, and that could happen too. And it looks like that's what's happening in South Africa. That strain is not related to the one in England.
Gotcha. Well, thank you for answering that. I had a lot of questions on that. I think that's very informative, hopefully for the viewers as well. We did get another question in as well, this one from Linda. Linda asks, this is off the topic of the new strains that we just discussed. If an elderly or immunocompromised individual were to test positive for COVID, how would that individual gain access to the Regeneron infusion treatment?
Yeah, there is this new treatment. It's been out for several weeks now, and it's present in some of the hospital systems in Michigan. And it looks like it has some effect. The interesting thing about this drug is that it's supposed to be given early in the infection, and the purpose is not to give it to people who are in the hospital, have severe illness. It's basically given to people with mild to moderate illness, and it keeps them out of the hospital. And so it's given as an outpatient, not as an inpatient. And it's a prescription drug. And so typically it follows the diagnosis of COVID, and your doctor will say, I wonder if you're a candidate for this drug. And then your doctor will set up the appointment for you to get this drug. It is an intravenously administered drug. So you have to be hooked up to an IV to get the drug. And there's only certain places in the community that do that. IV infusion therapy is what it's called. So you'll need an appointment to have this drug administered, but it does seem to have some effect, and you can get it through the Bronson system and through most other hospital systems.
Gotcha. And is that in a pretty serious case?
Well, it's in a case that is symptomatic. That is, the patient has to have some sort of a pneumonia so that they have trouble breathing. Of course, they have to be positive for COVID, so it has to be an acute COVID case. It's best if it's given early, within the first few days of symptoms, and it's a one treatment protocol. So you get one dose and that's it. And so it's a very interesting approach, but it does require an intravenous administration. So it's a little more complicated than just taking a tablet or an intramuscular injection.
Gotcha. Thank you for answering that. So moving on here before we hop into our next topic, again, ladies and gentlemen, of those who are watching, I just want to remind you, use that hashtag there at the bottom of your screen. We saw one great question there from Peggy. If you have any other ones, use that hashtag there. Hey, Luke, I'll be able to see it, put it up on the screen, hopefully get it answered, again, if it pertains to the conversation that we are discussing at this time. So let's move in now to another question, is lasting effects. We talk about the loss of taste and smell. We receive emails about it from viewers. We even, friends and family that I have that have contracted the virus, they say it's taken a month, it's taken, a month and a half. Some people still don't have it back yet. What are the, lasting effects? We haven't seen, obviously, very long, but what ones, raise a red flag in your book?
The ones that we're particularly concerned with, one is just plain lung damage. When you have a pneumonia, your lungs are damaged, but in many types of pneumonia, it clears up. As soon as the infection is over, your lungs go right back to normal, and your pulmonary function is normal again. You can run, you can exercise, you can do everything just like you were before. Your lungs completely heal up. That does not seem to be the case for COVID. It looks like COVID does severe damage and a different type of damage than many other types of pneumonia. So you might be out of breath, walking upstairs or doing any sort of exertion or exercise for months after you recover from COVID. I mean, you're recovered in the sense that you feel okay, and so on. But as soon as you exert yourself, your lungs are still not normal yet. So that's the one thing. Another thing has to do with the way your blood clots or fails to clot. And so what we're seeing in long-term COVID people that have a lot of these long-term effects is things like strokes. That is, there's something wrong with their vascular system. The inside of your blood vessels is called the endothelium. And this virus does something to that. And it causes you to have clots and strokes. And so that can cause some long-term damage long after you've recovered from your infection. And then the last thing has to do with those neurologic symptoms. People are saying, I can't remember like I used to. I have loss of memory, or there's certain things that I used to be able to do quickly, like crossword puzzles or whatever. Certain neurologic things that used to be normal now are slower. And so it looks like this this virus does something to your nervous system and to the brain related to, taste and smell and other things. It damages your nerves somehow. So your point is very well taken, that some people get a very mild case and they're right back to normal again, and some people have lots of these long-term complications of COVID, and it's very problematic in those patients.
And so we see those asymptomatic patients, and then we see some serious cases. What ballpark percentage of people are facing those, the serious lung damage, the, blood clotting, the loss of memory, the neurological issues?
Yeah, it's typically people that are more on the severe end of the spectrum. So it's probably 5% of people that end up hospitalized, and a smaller number that end up in the ICU. And that's the kind of patients that have this long course of COVID where it takes many, many months for them to recover. So I would say, if I had to associate it with anything, it would be a patient that ended up in the intensive care unit. They're the most likely to have this long course.
And so, okay, thank you. And moving on, next topic here is that we hear it from politicians. We hear it, more importantly, from doctors. There's light at the end of the tunnel with the vaccine here on the horizon. Do you see us tailgating in the fall? Do you see us celebrating the 4th of July, Halloween, even in the holiday season of 2021? Do you see that happening?
At this point, I think your wish or your anticipation of 4th of July is probably too optimistic, and if you're trying to relate that to the use of the vaccine, I think you have to realize the timing of that isn't going to work, because we would need a lot more vaccine before then if we were going to significantly change the situation by the 4th of July. And we're just not getting that many doses of vaccine. So I think it's going to take months in order to go through each of the phases of the vaccine program. And we're basically looking at next fall or next winter before we have enough people immunized to really change the trajectory of the epidemic.
Is there anything else, as we wrap up here, anything else that you would like to add? Just whether it's with vaccines, anything that we haven't hit on that you would like to say, any, misconceptions or misinformation that you would just like to debunk?
There is. I've been in this business for a long time, and I've worked with vaccines for a long time, and I have to say that this vaccine, or these two vaccines that we have right now, the ones that are made with what's called messenger RNA, these are amazing vaccines. They're the safest and most effective vaccines we have ever had in the world. And I give, you have to tip your hat to the researchers that discovered these vaccines and this mechanism, because they're just amazing. They're incredibly safe, and they're very, very effective. So people who have concerns about whether the vaccine is going to work or not, whether it will protect me, whether I need it, don't worry about that. It's a great vaccine, and you will have protection when you take both of your doses. And then people who are worried about safety, will it give me the disease, or will it make me infertile, or will it do this or that? The answer is no. These are extremely safe vaccines. They're well tested. We have millions and millions of people around the world that have taken these vaccines yet, and we have data on all of those people. And so these are extremely safe vaccines. If you have any questions, ask your doctor. But I would not have any serious concerns about the safety or efficacy of the vaccines that we have now, and everyone should take it.
Dr. Van Eck, I really appreciate your time this morning. One last question that I'd like to go out on is, that was actually a good kind of segue into this one, is tell us something good. You said something very great there about the vaccines, but I'd like to end on tell us something good. What can you say?
Well, I think if the vaccine is accepted by the American people and we're able to, immunize a significant proportion of the population, then this pandemic will go away. And the sooner that we mask up, and keep our distance and control our social interactions and take the vaccine, the sooner this pandemic is going to go away. So really, it's in our hands. It's in our hands to control this. It's not some outside force that's inflicting this on us. It's totally under our control to make this pandemic go away. So if you want it to go away, then do what you need to do to make that happen. And if you don't, then the vaccine or the pandemic is just going to go on and on and on, and we'll be dealing with this again next year.
Dr. Van Eck, I really appreciate your time again. I'm going to ask you just to hold on here for a minute before you hop off the call. I'm going to wrap up our stream here. Ladies and gentlemen watching, thank you very much. This has been another Live Desk conversation here at the Wood TV Live Desk. I'm Luke Lasser, again joined by Dr. Van Eck of Bronson Healthcare. Have a great morning or afternoon at this point. I think we're at noon. Have a great day. We'll see you around.